Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 17th lecture on systemic pathology. Today, day 1 of diseases of gallbladder. Day 1 of diseases of gallbladder. Dear audience, today's topic is cholelithiasis. What is cholelithiasis? A stone in gallbladder is known as cholelithiasis. A stone in gallbladder is known as cholelithiasis. Suppose this is the gallbladder and these are the stones. This is cholelithiasis. Now come to what are the different types of gallstones. Cholesterol stone, about 85% stones are cholesterol stone. Cholesterol stone is predominantly composed of cholesterol. It is predominantly composed of cholesterol. Bilirubin stone, or it is called pigment stone. Pigment stone is predominantly composed of bilirubin. It is predominantly composed of bilirubin. Mixed stone. Mixed stone is composed of cholesterol and bilirubin. It is composed of cholesterol and bilirubin. So three types of stone: cholesterol stone, pigment or bilirubin stone, mixed stone. Dear audience, now come to predisposing factors of cholelithiasis. First come to predisposing factors of cholesterol stone. Factors of cholesterol stone. is sex, fair, fatty, that is obesity, fertile, diet, oral contraceptives. These are the predisposing factors of cholesterol stone. First come to age. Cholesterol stone usually common around the age of 40. Common around the age of 40. It is common around the age of 40 years. Sex, cholesterol stone is common in female. Dear audience, in female, the estrogen hormone is associated with increased synthesis of endogenous cholesterol. Due to increased synthesis of endogenous cholesterol by estrogen, cholesterol stone is more common in female. Estrogen in female is associated with increased synthesis of endogenous cholesterol. So there is cholesterol stone. Fair, cholesterol stone is common among the fair individuals. Cholesterol stone is common among the fair individuals. Fatty, cholesterol stone is common among the obese. Common among the obese individuals. Fertile, cholesterol stone is more common among the mother with multiple pregnancies. Common among the mothers with multiple pregnancies. Diet, cholesterol stone is common among those individuals who are habituated with high fatty diet. Common among those individuals who are habituated with high fatty diet. oral contraceptives, deodorants, cholesterol stone is common among those mothers who takes oral contraceptives regularly. Common among those mothers who takes oral contraceptives regularly. These are the predisposing factors of cholesterol stone. Now come to predisposing factors of bilirubin stone. Predisposing factors of bilirubin stone. Deodorants, sustained hyperbilirubinemia is associated with pigment stone. That is, sustained hyperbilirubinemia is associated with bilirubin stone. Sustained hyperbilirubinemia is associated with bilirubin stone. Deodorants, one of the important cause of sustained hyperbilirubinemia is thalassemia. Deodorants, thalassemia is a congenital hemolytic anemia and it is a genetic disorder. In case of thalassemic patient, there is sustained hyperbilirubinemia, and this sustained hyperbilirubinemia in thalassemia may lead to bilirubin stone in the gallbladder. In thalassemia, there is sustained hyperbilirubinemia. Sustained hyperbilirubinemia, and due to sustained hyperbilirubinemia, there is chance of bilirubin stone. Bilirubin stone in gallbladder. So this is the predisposing factor of bilirubin stone. Now come to pathogenesis of cholelithiasis. Pathogenesis of cholelithiasis. Dear audience, first come to pathogenesis of cholesterol stone. Pathogenesis of cholesterol stone. Steps of cholesterol stone formation. Supersaturation of bile with cholesterol, nucleation or initiation of stone formation, hypomotility of gallbladder, accretion. Dear audience, steps of cholesterol stone formation. supersaturation of bile with cholesterol, initiation of stone formation, that is nucleation, hypomotility of gallbladder, and accretion. Supersaturation of bile with cholesterol. Supersaturation of bile with cholesterol. Dear audience, whatever may be the cause of hypercholesterolemia, there will be increased amount of cholesterol in bile. Whatever may be the cause of hypercholesterolemia, there will be excess cholesterol in bile. If this is the gallbladder and this is the excess cholesterol. This is cholesterol. This is excess cholesterol in bile. And this excess cholesterol in bile is supersaturation of bile with cholesterol. Excess cholesterol in bile, it means supersaturation of bile with cholesterol. Again, whatever may be the cause of hypercholesterolemia, there will be excess cholesterol in bile. This excess cholesterol in bile is nothing but supersaturation of bile with cholesterol. Dear audience, we know bile salt and bile acid keep the cholesterol dissolved. Bile salt and bile acid keeps cholesterol dissolved in bile. When there is excess cholesterol in bile, when excess cholesterol in bile, what happens? The mucin binds with the cholesterol and make the cholesterol crystalline. When excess cholesterol in bile, mucin binds with the excess cholesterol and makes the excess cholesterol crystalline. Crystallization of cholesterol with the help of mucin. And this crystallization of cholesterol is known as nucleation of stone formation or known as initiation of stone formation. This is nucleation of cholesterol stone formation. Again, bile salt and bile acid keeps cholesterol dissolved in bile. When excess cholesterol in bile, mucin binds with the excess cholesterol and the cholesterol is converted to crystalline. And this crystallization of cholesterol is the nucleation of cholesterol stone formation, or this is the initiation of cholesterol stone formation. Dear audience, if this is the mucin, it binds with the excess cholesterol and makes the cholesterol crystalline, and this is known as nucleation. Dear audience, now come to hypomotility of gallbladder. Dear audience, this is the gallbladder. And this excess cholesterol undergo crystallization with the help of mucin, and this is the nucleation. If there is hypomotility of gallbladder, the gallbladder cannot contract properly, and so the nucleus of cholesterol stone will not be expelled out. Hypomotility of gallbladder, nucleus of cholesterol stone is not expelled out. So the nucleus of cholesterol stone remain within the gallbladder. Nucleus of stone remain within the gallbladder. But if the gallbladder is not hypomotile, it can contract properly and all the nucleus of the cholesterol stone will be expelled out. As there is hypomotility of gallbladder, nucleus of the cholesterol stone is not expelled out. Rather, it remains within the gallbladder. Now come to accretion. Dear audience, as the gallbladder is hypomotile, there is formation of nucleus of cholesterol stone, and as there is supersaturation of bile with cholesterol, more and more cholesterol will precipitate on the nucleus and there is formation of stone. As hypomotility of gallbladder and supersaturation of bile, with cholesterol, more and more cholesterol will precipitate on the nucleus. More and more cholesterol precipitates on nucleus and there is formation of stone. Dear audience, you know this is the nucleus. More and more cholesterol will precipitate on the nucleus and there is formation of stone, and this is the stone. This is cholesterol stone. Again, whatever may be the cause of hypercholesterolemia, there will be supersaturation of bile with cholesterol. Excess cholesterol in the bile binds with the mucin, crystallization of cholesterol. And this crystallization of cholesterol with the help of mucin is known as nucleation. After formation of nucleus of cholesterol, if there is proper contraction of the gallbladder, it will be expelled out. But if there is hypomotility, the nucleus of the cholesterol stone will not be expelled out. There will be accretion. More and more cholesterol will precipitate on the nucleus and there will be formation of cholesterol stone. Dear audience, now come to pathogenesis of bilirubin stone. We know sustained hyperbilirubinemia, as in thalassemia, associated with pigment stone. Now come to steps. Steps of formation of bilirubin stone. Supersaturation of bile with bilirubin. Dear audience, you know bile contains bilirubin in physiological condition. In case of hyperbilirubinemia, there will be increased amount of bilirubin within the bile. And if there is sustained hyperbilirubinemia as in thalassemia, there will be sustained excess of bilirubin in bile as in thalassemia. Nucleation or initiation of bilirubin stone formation. Dear audience, as there is supersaturation of bile with bilirubin, this bilirubin will precipitate in the gallbladder. If this is the gallbladder, due to supersaturation of bile with bilirubin, there will be precipitation of bilirubin, and this is known as nucleation or initiation of bilirubin stone formation in sustained hyperbilirubinemia. If there is hypomotility of gallbladder, the nucleus of bilirubin stone will not be expelled out and it will remain within the gallbladder. As there is hyperbilirubinemia and hypomotility of gallbladder, more and more bilirubin will precipitate on the nucleus and there will be a formation of bilirubin stone, accretion. As there is nucleation and as there is hypomotility of gallbladder, more and more bilirubin will precipitate on this nucleus and there is formation of bilirubin stone. This is accretion, and these are the steps in sustained hyperbilirubinemia as in thalassemia. Dear audience, whatever may be the type of gallstone, what may be the complications of cholelithiasis? Intestine, this is pancreas, this is gallbladder, and these are the stones in gallbladder. Complications of cholelithiasis. Dear audience, if this stone obstruct the cystic duct, this is the cystic duct, what may be the complications? If the stone obstructs the cystic duct, bile will not be expelled out due to obstruction of the cystic duct by stone. What will happen? There will be mucosal, or there will be acute cholecystitis, and followed by acute cholecystitis there will be accumulation of pus, and this is known as empyema gallbladder. Empyema gallbladder. So if this stone obstructs the cystic duct, there is chance of development of mucosal, or there is chance of development of empyema gallbladder. If the stone obstructs the bile duct, what will happen? If a stone obstructs the bile duct, bile will not come from the liver in the gallbladder or in the bile duct. So there will be obstructive jaundice. Obstructive jaundice. And there is chance of ascending cholangitis. Ascending cholangitis. Chance of ascending cholangitis. So if the stone obstructs the bile duct, there is chance of obstructive jaundice and ascending cholangitis. If it obstructs the ampulla of Vater, this is ampulla of Vater. If the stone obstructs the ampulla of Vater, what will happen? If the stone obstructs the ampulla of Vater, again bile will not come, there will be obstructive jaundice. There will be obstructive jaundice. Again there is chance of ascending cholangitis. Ascending cholangitis. Dear audience, if there is obstruction in the ampulla of Vater, pancreatic juice will not come in the intestine, and there is chance of acute pancreatitis. Again, due to obstruction in the ampulla of Vater, pancreatic juice will not come in the intestine, so there is chance of acute pancreatitis. Acute pancreatitis. So if a stone obstructs the ampulla of Vater, there is chance of obstructive jaundice, ascending cholangitis, and acute pancreatitis. Another complication is intestinal obstruction by the stone at ileocecal valve. Intestinal obstruction at the level of ileocecal valve. Dear audience, if this is the colon, appendix and ileocecal area. A stone can obstruct at this level. This is intestinal obstruction by the gallstone. This stone can enter into the intestine through a fistula. This is known as colocolic fistula. If intestinal loop is here, there may be fistula between the intestine and the gallbladder. This is called colocolic fistula, and through the colocolic fistula, a stone can enter into the intestine and it can obstruct at the level of ileocecal valve. So intestinal obstruction at the ileocecal valve, and the stone comes through the fistula known as colocolic fistula. A stone enters into intestine through the colocolic fistula. Fistula made between the gallbladder and the intestine. Another complication is carcinoma of gallbladder. Dear audience, if this is the gallbladder, you know the lining epithelium of gallbladder is columnar epithelium, you know. If stone remain for long time in the gallbladder, there will be squamous metaplasia. Due to squamous metaplasia, there is chance of carcinoma of gallbladder. Stone in gallbladder due to irritation exerted by the gallstone, the columnar epithelium of gallbladder is replaced by squamous epithelium. Again, stone in gallbladder due to irritation exerted by the stone, columnar cell of gallbladder is replaced by squamous epithelium, and this is known as squamous metaplasia. And this squamous metaplasia may turn to dysplasia and ultimately carcinoma of gallbladder. Dysplasia and carcinoma of gallbladder. These are the different complications of cholelithiasis. Dear audience, today I have discussed briefly about the cholelithiasis. Stone in gallbladder is known as cholelithiasis. Cholesterol stone, it is about 85%, and predominantly it is composed of cholesterol, bilirubin stone or pigment stone, mixed stone. Predisposing factors of cholesterol stone is around the 40 years of age, it is common. Sex, it is more common in female due to estrogen hormone. The estrogen hormone is associated with increased endogenous synthesis of cholesterol. It is more common among the fair individuals and in the fatty individuals. Cholesterol stone is common among those individuals who are habituated with high fatty diet. It is more common among the mothers with multiple pregnancies and the mothers who takes oral contraceptives regularly. The predisposing factor of bilirubin stone is sustained hyperbilirubinemia, and sustained hyperbilirubinemia usually found in thalassemia, a congenital hemolytic anemia. There are steps of cholesterol stone formation, supersaturation of bile with cholesterol. Mucin makes the excess cholesterol crystalline. This is nucleation. If there is hypomotility of the gallbladder, the crystalline cholesterol is not expelled out. More and more cholesterol will precipitate on the nucleation and formation of cholesterol stone. This is accretion. Steps of bilirubin stone formation, supersaturation of bile with bilirubin, as in sustained hyperbilirubinemia. There is nucleation, hypomotility of the gallbladder, and accretion. That is, more and more bilirubin precipitates on the nucleation and formation of bilirubin stone. Whatever may be the type of stone, what may be the complications of cholelithiasis. If the stone obstructs the cystic duct, there is chance of mucocele and empyema gallbladder. If it obstructs the bile duct, there will be obstructive jaundice and ascending cholangitis. If it obstructs the ampulla of Vater, there is chance of obstructive jaundice, ascending cholangitis, and acute pancreatitis. There is chance of intestinal obstruction, and the stone can enter into the intestine through a fistula made between the gallbladder and intestine. This is called colocolic fistula. There is chance of carcinoma of gallbladder because the stone irritates, and due to irritation, the columnar cell of the gallbladder is replaced by squamous cell. This is called squamous metaplasia. It may turn to dysplasia, and ultimately there is chance of carcinoma of gallbladder. Dear audience, this is all about the cholelithiasis briefly. To adapt to this, thanks all.